Let's cross live now to the Walter Reed Medical Centre, where Mr. Trump is being treated, and speak to our correspondent, Libu Diseko. So, Libu, we were hearing there from the president's doctors that he's doing very well, but they didn't really want to comment on specifics, especially not whether he'd ever had oxygen.
Absolutely. There are a number of questions that have been raised as a result of that press conference. Also, the team said that he was diagnosed 72 hours ago, and actually he only announced that he had coronavirus on Friday. Similarly, as you said, journalists did press on whether he's received oxygen at all. The answer was that he's not taking oxygen at the moment. And in the last few minutes, we've had a statement from the White House pool. Now, they are usually briefed by very senior members of the White House, so we do have to take this very seriously. What they're saying is that the president's vitals over the last 24 hours were concerning, and the next 48 hours will be critical in terms of his care. We're still not on a clear path to recovery. Obviously, that is a very different tone from that of the press conference we heard, the update from Donald Trump's medical team.
Libu Diseko, it certainly is. Well, let's speak to our senior North America reporter, Anthony Zerka. So, Anthony, we have then the president's physician giving rather a glowing report of his health, but then a source familiar with the president's health tells the White House pool the president's vitals over the last 24 hours were very concerning, and the next 48 hours will be critical in terms of his care. We're still not on a clear path to a full recovery. What are we to make of the dissonance there?
Well, what we are to make of it is if the goal of this press conference here on Saturday morning was to put the nation's mind at ease that the president is doing well, that his medical team is on top of everything and in charge, that was not a successful mission. All they've done is create more confusion thanks to the conflicting statements about how the president is doing, about whether he was on oxygen in the past or not. And also the timeline, as we mentioned earlier, the timeline about when the president was diagnosed. 72 hours ago would put it on Wednesday when the president revealed he was diagnosed at 1 a.m. local time on Friday morning. Now, the White House has come out since then and said, no, the Dr. Sean Connolly meant 3 days ago, Thursday night, that he started drugs also on Thursday night to treat the diagnosis. But the fact that they're having to clean this up now, immediately after a press conference, whose goal was to settle things down, is just a remarkable mishandling of this.
We did hear at the press conference that the president is going to be treated with remdesivir. It's a 5-day course. So how long can we expect him to be there?
Well, you know, if you look at CDC, Centers for Disease Control guidelines, you are supposed to be, if you tested positive, in isolation for 10 days after that initial positive test, and you have to be symptom-free. So one would imagine that it is going to be a while before Donald Trump can hit the campaign trail again, whether that means he can go back to the White House and be in isolation there or stays at the medical center. I think we don't have any details on that as well. But we have to remember the reason he moved to the hospital was because they wanted to have all the different tests, all the different facilities available for him. So I don't think they're going to try to move him back until they feel like they're out of the woods. And as that senior administration or someone familiar with it, the president's health said, he said that the next 48 hours are going to be key.
It was interesting also in that briefing with the president's doctor how reporters pressed him on, was the president ever on oxygen? And Senator Marco Rubio, an ally of the president's, Republican senator in Florida, has said because of all the conspiracy theories surrounding the president, which are now online, it's critical to get accurate information. But it seems like now the waters are muddied, doesn't it?
It does. As I mentioned, they were trying to clarify things, but to have the president's position be evasive like that on basic questions like, was the president on oxygen? I think it undermines the credibility not just of the White House, but of the medical team. You have to remember, in crisis situations like this, credibility, trust from the media, from the American public is invaluable. And any misstatements that have to be clarified, any misdirections, that squanders that credibility that they're going to be relying on to calm the American public, to make the world, the financial markets, more at ease with the situation. We, American people, the financial system, everyone else has to have faith that they're getting the truth from the White House and from the physicians.
Anthony Zurcher, thanks so much for joining us.